Welcome to Vitality VIP's Wellness Elite channel. Let's start.
Hi, I'm Dr. John, a supporter of natural healing methods. In today's episode, I will tell you about 20 symptoms of mental illnesses that should never be ignored. Unfortunately, a significant number of people are unaware that they are suffering from a mental illness. Such is the nature of these illnesses, and they not only destroy our personal and professional lives, but also have a tangible impact on our health. It is important to be able to recognize at least the basic symptoms that should lead us to the correct diagnosis and commencement of appropriate treatment. Before we begin, I have a request. If anyone would like to contribute to the growth of our community on this channel, all you need to do is click the subscribe button below the video, and then the bell icon that appears next to it. If you find my videos helpful, I think it's worth doing, as subscribing will also ensure that you don't miss out on other valuable videos. Thank you in advance, and let's get back to the topic. What symptoms should we pay attention to? To find out, listen to today's episode until the very end. In this video, I will discuss the topic of the most common symptoms of mental illnesses. Of course, not all of them occur in one condition, but each one should be a signal for you that something disturbing is happening. I will now present you with a list of symptoms that we certainly cannot ignore in any way, and if we are not yet familiar with them. Number 1 is a clear decrease in mood. Often, the first symptom that may be a sign of a mental illness is a clear decrease in mood. In many cases, the sick person would prefer to spend the whole day in bed, wearing only pajamas, often not answering the phone because they feel that no one understands them and they do not feel like contacting anyone. It also happens that they cry frequently, although often not knowing why. Poor well-being is also associated with neglecting all responsibilities, such as not going to work, school, or university. In the second point, we will discuss mood swings, anger, and excessive hostility. The presence of a mental illness is very often indicated by a certain unpredictability. It happens that a sick person can laugh for no reason and then cry. Such behaviors may indicate that the person is in a completely different, isolated world. Some mental illnesses manifest through anger and excessive hostility. The outburst of immense anger usually stems from an inability to cope with stress. Serious outbursts of anger can sometimes end in violent attacks. Ignoring such symptoms leads to serious consequences in both professional and interpersonal relationships. Another significant symptom is social withdrawal, where the person suddenly loses interest in the lives of loved ones and begins to visibly isolate themselves. This could be indicative of a developing illness, often pointing to depressive states, although it could also be a symptom of social phobia. The fourth point is excessive anxiety, which can manifest in many different ways. Sometimes it can be panic attacks, while others feel anxiety about leaving their home. This symptom also appears in the form of phobias and fear of other people, making daily functioning difficult. Mental illnesses also lead to sleep disorders. In extreme cases, this can lead to total insomnia, resulting in chronic fatigue. However, some patients may experience excessive sleepiness caused by their illness. In the sixth point, delusions will be discussed, which are beliefs that cannot be explained logically to a sick person. Moreover, they can manifest in very different ways. Some patients feel that they are being followed, while others are convinced that they are all-powerful. Delusions can also be associated with an incorrect interpretation of various behaviors. If someone accidentally bumps into a sick person, for example, on a tram, they may perceive it as a deliberate attack on their person. It's also worth mentioning narcolepsy, which involves sudden, involuntary attacks of sleepiness during the day. Some people experience sleep-disordered breathing, such as snoring or apnea. Patients with certain conditions may also experience nightmares and nocturnal fears, tremors and night leg cramps, and even episodes of sleepwalking. Point 8 is derealization, a symptom similar to depersonalization. However, derealization is associated with a sense of unreality of the world. The person feels that it is inexplicably different, unreal, and completely distant, reminiscent of a waking dream. Objects and people may also appear unreal, and the person may have thoughts like, "It's all in my head," and "This isn't real." Depersonalization, on the other hand, is a sense of detachment and presence in relation to oneself, one's body, or the world. A person with this symptom observes their body or mind as if from the outside, as if they were separated from themselves. They often have a sense of unreality that is reminiscent of sleep. Sometimes, they may feel a loss of identity and perceive themselves as unreal. Depersonalization can be a symptom of various mental illnesses. Point 10 is an atypical way of speaking. As I mentioned earlier, certain mental illnesses, such as schizophrenia, are often characterized by an unusual way of speaking. However, this applies not only to sudden changes in topics associated with thinking disorders but also to the fact that sick individuals often give answers that are not related to the questions asked. They also use formulations whose meaning is known only to them. Sometimes people communicate with others through rhymes, and their statements can be obscene or even vulgar. Additionally, observing such people often gives the impression that they are talking to someone who is not present in the room. These illnesses are also accompanied by thinking disorders, and the thoughts of mentally ill individuals often seem very disorganized. During conversations, they may jump from one topic to another, and furthermore, these topics are not related to each other in any way. For example, they may first talk about what they had for lunch today, and then about a characteristic memory from their childhood. Mentally ill individuals also often fail to finish the threads they started moments ago. Just a quick reminder, if you haven't already subscribed to our channel, click the button below to get more interesting knowledge about your health. In point 12, we will discuss compulsions. Compulsions are a characteristic symptom of obsessive-compulsive disorders, and they can concern both thoughts and behaviors. In the first case, the patient cannot get rid of thoughts that make daily functioning very difficult. In terms of behaviors, there are certain ritualistic actions, such as constantly tightening faucet knobs or checking if the apartment has been locked. Sometimes, due to their compulsions, patients cannot leave their homes normally. Mentally ill individuals also collect strange items and suddenly change their interests. Have you noticed any peculiar behavior in a loved one? This is one of the most common symptoms of schizophrenia. If a patient suddenly starts collecting certain unusual items that many others would consider garbage, it is certainly a sign of something disturbing. It is also possible that people with schizophrenia hoard huge amounts of food without being able to explain why. Another symptom that should raise concern is a sudden and complete change in dress style or the adoption of garish makeup by individuals who previously had no need to stand out from the crowd. Symptom 14. Hallucinations are present with cognitive function disorders. Hallucinations are also associated with delusions in medical terms. They are sensory experiences that are illusions, but the body perceives them as real. As a result, the affected person sees images or hears voices that do not actually exist. Some psychiatric disorders also lead to a decline in cognitive function. How to recognize it? For example, in the case of teenagers, problems with learning suddenly arise, which were not previously present, mainly related to concentration difficulties, but also with memory problems. The problem of cognitive dysfunction also occurs in adults, but it is more difficult to notice in this case. However, if a person who has been successful in their job suddenly cannot perform even the simplest tasks, there is most likely something wrong with that person. There are also olfactory hallucinations, in which patients perceive non-existent smells, such as the smell of burning. Sometimes schematic hallucinations occur, which involve feeling certain tactile stimuli, such as the sensation of insects moving on the hands. The last type of delusions are taste hallucinations associated with the perception of a certain, usually unpleasant, taste without any stimulus for it. Symptom 16. Eating problems are a symptom of a psychiatric disorder. A serious signal indicating the presence of a mental illness is a drastic change in eating habits. It happens that people who have eaten relatively little before suddenly begin to eat uncontrollably, while others generally stop eating. This usually concerns patients with anorexia who perceive themselves as overweight due to a distorted self-image. Patients also show a tendency towards self-harm. Often, autoaggression accompanies mental illnesses. This term refers to a range of actions aimed at inflicting physical or psychological harm, unfortunately, towards oneself. Autoaggression can be verbal or non-verbal. The first type involves lowering one's own value and frequent self-criticism. Non-verbal autoaggression is associated with purposeful harm to the body and can manifest itself in the form of superficial or deep-cut wounds, but also in the extreme case of acid hunting or hitting sharp objects into the skin. Another symptom is changes in the sexual sphere. The result of diseases and psychological disorders can be a decrease in sexual desire, and in seriously ill people, there may also be some changes related to sexual habits. Most often, this concerns sadomasochism and other paraphilias, and premature ejaculation is often noticeable in such people. Unfortunately, addictions often accompany mental illnesses. They can be associated with the abuse of various substances, but also with various activities over which the sick person has no control whatsoever. However, it is often most difficult for the sick person to notice that they are dealing with a serious problem. Addictions take very different forms, ranging from gambling to drug addiction. Symptom 20 is suicidal thoughts. When talking about the symptoms of mental illnesses, we cannot forget about suicidal thoughts. This is a very serious symptom that should never be ignored, especially in those who have previously been cheerful and achieved considerable success. Suicidal thoughts can result from many complex factors, often stemming from a sense of worthlessness and inability to adapt to the environment, but it is a much more complex problem. And that was the last point in today's episode. That's all for me for today. Thank you for your attention. Don't forget to subscribe to our channel for more exciting information about your health. See you in the next video.